Okay.
Okay, this is going to be the competency skill for doing lithotomy drape. And there's many ways to do it, as we discussed before. But this is going to be for if we were doing a procedure that would include something like a DNC or a DNC hysteroscopy, or maybe Bartholin cyst or some sort of cyst down in the perineal area. We maybe even do this kind of drape for like a hemorrhoidectomy procedure. Now, this is not going to be probably the drape that you would see if you were going to do a procedure such as a diagnostic lap, because in a diagnostic lap, you need to have an abdominal prep and drape as well as a vaginal perineal drape. And the drapes that they have in surgery right now, you're probably going to have to learn how to do when you get to surgery. They're one-piece drapes. I do have them in the classroom. I will show you how to use them, but I only have a few, and to refold them would really be a nightmare because it's unbelievable. It's a one-piece drape, and essentially it has a fenestration or an opening in the abdomen as well as a perineal opening. Plus, the leggings are connected to the one-piece drape. So as you can imagine, the drape goes on over the abdomen, then it falls down between the legs, and then it goes up over the stirrups. And so that's quite complicated draping. Whoops, oh nice. Nice, quite complicated draping. And so we'll probably forego that till you get to the actual institution. So what we're going to do today is just a lith sock drape, lith socks separate from all the drapes. Now, what I have is an under buttock drape. And some hospitals use these, some use just a sheet. You could even use a gown. You could turn a sterile gown upside down and use the square or the flat part and use that. You could use a sheet. You could use a mail stand cover. There's many different things that you could use to accomplish the same thing. This just happens to be an under buttock drape that has a left and a right hand side to it, and I'm going to unfold this so you can see it. It has a pocket here, so you will protect your gloved hands in the pocket. So what you need to do is you need to set up your back table appropriately in the proper sequence for the drape. So the last thing that goes on the patient is the first thing that goes on your table. So in this scenario, the first thing that you're going to use is an under buttock drape, followed by a minimum of 3 towels. And then you may or may not put a towel up on the lower abdomen. You could use a sheet too, followed by individual list socks. Now the list socks we're going to use today are cloth. Most of them in the hospital are paper, but these seem to be easier to fold and easier to work with for practicing. And we are also going to use 2 perforating towel clips. Now keep in mind that this is physician preference. So this is just one way of many ways to do this. So for purposes of testing, let's do it this way. If you learn it this way, you'll be able to adapt to individual surgeon likes in the hospital. So we have set this up so that our 2 list socks are on the bottom, followed by our towels, and followed by our under buttock drape. So now I'm going to open up the under buttock drape on my back table. In this case, we're using the mail stand. I'm going to put both my hands in the pocket to protect it. And now I'm going to step back from my field, unfold the drape, and I'm going to protect my hands. I'm going to come over and I'm going to slide this underneath the patient's buttocks. Now, if your bed is too low, which this is kind of low for me, so Randy, I'm going to have you put the bed up for me. And here's something you want to be careful of. If you're wondering where to put it, you're not sure, don't tilt this and look over it and touch your chin because you're going to contaminate. Don't touch the patient's heels as you put this in. So unfold the drape, kind of crunch it together, come up, and you have to come up at this angle and slide it underneath the patient's buttocks. Now, in the real world, it won't be a mannequin, and it would be highly unlikely that you would push the patient to the head of the bed. Their buttocks and their weight is going to push down, and so you have to kind of shimmy to get that drape underneath their buttocks. As I said, this could have been just a regular sheet. And so then you could take it like you would a surgeon's gown, put your thumbs in, roll your hand, and tuck it under like that too. So it doesn't have to be a manufactured under buttocks drape. You could do it with any kind of drape. The main thing is you have to protect your hands. Now make sure that you don't touch her when you're coming out, because remember, you're gowned and gloved, right? And if you want to practice this being gowned and gloved, that might be a good idea so that you remember you are sterile. Now, we're going to take our towel, we're going to unfold it, and we're going to make a triangle shape. So you grab opposite corners, pinch it together, back up from your field, come over, and it doesn't matter if you choose the left or right side, but you have to be careful not to contaminate yourself as you're putting this in. And you're going to just lay it in like this. Now also, remember in the real world when we were practicing the lithotomy position and we said if we put a live person on here, their legs would be out more. And so this truly, if you can do this in the classroom, this is going to be very easy in the hospital. Now we're going to take our second towel, open it up, always over your sterile field, and make another triangle. Step away from your field, come over, and don't touch this now. Come in carefully and lay this like this. That's our second towel. Now our third one, we kind of make a little lip like we did with our laparotomy drape. And we're going to place that, grab your two perforating towel clips, and we're going to place that over the anus. And so you can separate the towels a little bit, find the patient's anus, and now one perforating towel clip there, one perforating towel clip here. Okay, now, most surgeons like to set a few instruments up on the patient's lower abdomen. And so to provide kind of a sterile table for them, we're going to put another towel. You could squeeze through this way, or you could choose to come around, being careful not to contaminate yourself, and lay that towel down like that. You could use a sheet. If you didn't have something, you could use a patient gown, or a surgeon's gown again. Turn it around and use a gown as a drape. Now we're going to put the list socks on. Now the list socks are going to come folded like this. And I'll open it up so you can see this. This is what the list sock looks like. It's got a split. And so it's going to come folded, kind of an accordion pleat fold. And this lip will be folded back. Now this is how I like to do it. I like to grab it, and if I'm going to do this leg first, her right leg, I'm going to grab this clump of material in my hand, and this cuff is folded back. Put your palm up, grab about a third of the way down. This is not working well. A third of the way down. Protect your gloved hand, and now you're going to drape the candy cane stirrups. Okay, now, where this needs to stay sterile is right in here, which is going to end up in the medial part here of her leg. Don't drag it over her foot. Don't drag it down the leg. You need that drape to come right down to the midline here. Remember where you prepped when you did your vaginal prep? So once again, palm up, grab this like this, protect your hand. You're going to come over here like this. Would you take that for me? Okay, now put this over the candy cane stirrup. Let go of the clump inside and pinch just the top of the drape. So watch. Pinch this, come over her heel, and pull down. Do not let this drag down. Pull right to here and let it go. Okay, we're going to do the same thing with this drape. We're going to pick up this drape. Hang on, it wasn't folded right. Pick up this drape, let it unfold, and now I'm going to do the other side. So I'm going to use my left hand. I'm going to grab this like this, come over here. You have to sort of be on the side of this. This is going to be hard for shorter people. Get over the candy cane, let go of the clump, and pinch the shiny. Now, don't look over to see where you are. You kind of have to come over here, extend your arm over the foot, straight down. Then you can separate this, and you're going to do your procedure. Now, I'll say one more thing. As I said before, the legs are going to be out more. If you were doing a vaginal hysterectomy, there would be 3 people in here. 1 on each side to retract and the surgeon in the center. So 2 assistants and the surgeon. It is pretty common to maybe contaminate the drape with your hat, face. So we're mainly concerned about in here. But in the real world, the legs are out a little bit more. So that's the lithotomy drape.